I think that the pandemic brought out to the public the critical role that nurses play, but it's no different than it's always been, which is that, nurses are the healthcare worker that stays at the bedside of the patient or, in their home. I'm Susan Groenwald, and I started my career as a staff nurse in the hospital, and then within a few years, went and got a master's degree in oncology nursing. So I spent a number of years in oncology, teaching, practicing, and wrote a number of textbooks. My most recent career was as president of Chamberlain University, which is one of the largest nursing universities in the United States, with nursing degrees from bachelor's degree through doctoral degrees. And then some public health as well. I retired from there a couple of years ago and recently joined the advisory board of HIPPO earlier this year. The nurse is the one who has the most contact with the family and patient, and so therefore has the broadest perspective of about what those patients and families need, and often is the coordinator of care to pull in resources from wherever that patient and family needs it. So there's nurses at various levels, depending on where you are in the world. In the United States, we have associate degree nurses and bachelor's nurses that are prepared for licensure, but then we have advanced degrees as nurse practitioners, master's degrees, specialties, and two different doctoral levels, one more focused on practice and one more focused on research. There are a variety of solutions. We would love to educate more and more nurses at higher and higher levels to take on more and more of the accountability for healthcare that they're capable of. The challenges to that depend on the country, but in most countries, including the United States, it's often a shortage of faculty to teach those students, or could be capacity at the schools themselves, which sometimes is related to faculty, could be space, number of factors that prevent us from doing formal education. Short formal education, then other ways to help are to train people at all levels to do certain things. So for example, in a number of areas, we could train what we call community workers that are not nurses. They aren't skilled and trained like nurses, but they can provide very critical roles to help patients and families in, say, adherence to medication or just coping in their homes. So that's one example of a lower level that we could do a lot of if we had the network to train those kind of people in the community. I don't have extensive experience, but in my role as president of Chamberlain University, a team of our folks made contact in the Seychelles. And we're able to work with the Seychelles government, the Ministry of Health, along with the World Health Organization, in this case, was very instrumental in helping get things set up for us. But we worked with the local nursing leaders on the island, which is important to know, what are the needs and what are the challenges, and also what are the governmental regulations that you have to go through to get approval to do something there. But what we were focused on in the Seychelles was formal nursing education, increasing the number of nurses who were trained, and they were particularly interested in Western nursing. They wanted U.S. trained nurses to be at the bachelor's level and master's level. And so that was our focus because that was our specialty. So through online virtual education, we collaborated with the local nursing leaders and the government to provide first bachelor's level degrees to those who are already in a technical nursing role. Once they had a bachelor's degree, then we educated 30 of those nurses with master's degrees who then became the faculty for the local school. So in that way, we established a relationship where they were able then to perpetuate the education on the island themselves. We did all that through online education. We were on the island a few times to meet with people and to understand how to get it done, and how, who the players were going to be, what some of the challenges on the island would be for those students. But that was the end result, and it's still ongoing, bachelor's and master's education on the island. When I first heard about HIPPO, I was so excited because Chamberlain is very skilled. That's my main experience in nursing education most recently, is very skilled at online education, which is very different than the way a lot of people do it. It's not a matter of just putting lectures online and having students, there is a very prescribed way of teaching online that Chamberlain is very skilled at. But one of the things that is difficult to do online is teaching hands-on skills, right? So when I heard about HIPPO and the device particularly, there's a number of opportunities that HIPPO provides, but one is this voice-activated headset that provides a first-person view of whoever's wearing the device on their head as they're dealing with a patient, or let's say it's a standardized patient, not a real patient, but a standardized patient. We can teach skills in one of two ways. Either the faculty is in the room with the patient demonstrating a skill that students all around the world through a mobile device or a computer or whatever can see exactly what that faculty is doing, because you can see where that person's hands are, what they're seeing, what they're saying, what the patient is saying. Very different than a videotape where you might get somebody's back or the arm is in the way, or you can't really see. This is a first-person view of exactly where those hands are and what they're doing. So for skills training, it is, I've never seen anything like it. It's just fabulous. And there are other devices, but this one is just so crystal clear. And also because it is not glasses worn over your eyes, you don't get the dizziness. You are looking directly at the person. You, as the wearer of the device, are looking directly at the person, but people who are observing it see it from cameras that are elsewhere. So you're not distracted. You, the wearer, are not distracted by the moving of the head and that kind of thing. And everything is voice activated, so you don't have to do anything to this headset. So I think that the ability to enhance online education with a device like this, where we can actually teach clinical skills by having a faculty in the room, and also by having a student demonstrate skills that a skilled faculty somewhere else can observe and check off and assess how they're doing. And long term, anytime there are people from one country teaching in another country, the long-term goal is self-sufficiency. What you want to do is transfer all the skills and knowledge, so that there can be self-sufficiency to grow and stand on its own. And so, all these virtual tools help with that for sure.